Yeah, hello. My name is Dr. Steve Edelson, and I'm the Executive Director of the Autism Research Insitute in San Diego. Now, this webinar today is sponsored by ARI and the World Autism Organization. Now, first, let me say a few words about the Autism Research Institute. ARI was founded by pioneering researcher and parent advocate Dr. Bernard Bremland in 1967. And this is our 56th year of monitoring, supporting, and conducting research. More specifically, ARI funds studies, sponsors an international support group network with over 250 group members, as well as a science network. We sponsor in-person and online think tank meetings, publish original articles and books, produce webinars for the autism community, as well as healthcare providers, and actually quite a bit more. And you can learn more about what we do at www.autism.org. So right now I'd like to introduce Petra Dillman. She's the president of the World Autism Organization. Petra?
Hello, everybody. Good evening, and thank you for the opportunity to once again join a webinar together with the ARI. The ARI that Stephen was talking about, I subscribed to that in the 1990s and 2000 until our exchange rate became too weak. The World Autism Organization was started in 1998. It sprouted out of Autism Europe because there were many countries outside Europe that wanted to join, and it was too much for Autism Europe to handle by itself. So it was decided to create the World Autism Organization. And as the word says, it is for the whole world. And it's been going up and down and strong and not so strong. We're trying to hold international conferences every 4 years, starting out in Melbourne in 2000, Cape Town, Mexico, Kuwait, and then Houston. Then COVID hit. So at the moment, we've got new programs going whereby we'd like to provide free online webinars whereby parents and others who actually need basic information about autism and how to handle autism, how to work with people with autism, how to understand them, to be able to also have a good quality of life. And we're getting emails every week requesting help, either by people that would like to relocate to a place where there are more services, or they'd like to get funding from us, which is not possible because the World Autism Organization is made up of volunteers. So we also are dependent on sponsorship and donations. And thus, with the online opportunities these days, it is a cheaper way then to assist people because you don't have to move to another country to be able to provide the services that your child needs. So training and support and networking are sort of the main things that the World Autism Organization is doing at the moment. We'll be starting with these online programs next week, Monday. In the beginning, they'll be like half an hour long. Every now and then, there'll be also question and answer opportunities. And if anybody wants to have more information, they can visit our site, www.worldautismorganization.com, all in one word, or send an email to info@worldautismorganization.com. Thank you very, very much. Enjoy Dr. Nicholas's talk.
Yeah, thank you, Petra. So I'll make the introduction. Dr. David Nicholas is a professor at the University of Calgary in Canada, and he's been active in the autism community for quite a few years. He has studied several areas regarding adults, including transitioning, which we'll talk about today, employment, and post-secondary education. He has published a couple hundred papers, which is quite impressive, and has received many awards for his hard work and dedication. Dr. Nicholas is actually a good friend of mine and close colleague, and I'm thrilled that he'll be presenting today. So welcome, Dr. Nicholas.
Thank you. It's a privilege to be here, and I welcome you all. I want to begin, if I may, with a territorial acknowledgement. I come from Alberta, Canada, and in Canada, it has become an important component of truth and reconciliation to acknowledge where we are and our land. And I want to recognize that I'm located here in Alberta, Canada, on the unceded territory of Indigenous peoples whose presence reaches back to time immemorial. I want to acknowledge with gratitude the history of Indigenous peoples welcoming many nations to this land of Canada, and want to honor the commitment to self-determination and sovereignty that Canada has made to Indigenous nations and peoples. I, as you know, am wanting to talk about the transition to adulthood in autism, and as the title says, focusing on challenges and opportunities in the aim of thriving. What I want to focus on broadly are two objectives. One is to explore the experiences of transitions from the perspectives of key stakeholders, autistic youth and adults, parents and supporters and service providers. And secondly, to examine what has emerged in our work, an ecosystem perspective that with a focus on three broad areas: employment, post-secondary education, and service navigation, all that are integral to that transition to adulthood. Just a little bit about the literature and background. So the literature in this field certainly needs further development. The support needs of individuals on the autism spectrum are not well understood in the context of the literature. And the intervention-based literature is largely focused on behavioral outcomes. Yet transition involves much more than that, and we'll talk about that. Some of the gaps are certainly a limited number of evaluation-based studies, quality and design issues within particular studies, a lack of research that looks long-term in terms of outcomes and impacts, and a lack of first-person involvement, both in the conduct and the priority setting of this research. So that really invites us to think deeply and critically as we move forward. In this juncture in our time, there's little accounting for some of the shifts relative to the COVID-19 pandemic that we all have walked through. And so what are the implications for transition and navigating? And lastly, some priorities in moving forward that are spoken about in the literature. Increased focus on quality of life as the focal point and the end point, and increased community and system level factors in this process of transitioning to adulthood. So I'll talk a little more about that as we move forward. You see on the screen here a hill. And this hill has been shifted over time. A path has been created. It wasn't always there. And it really, in my mind, speaks to an ecosystem, a community of interacting organisms in the context of their environment. And this environment has been shifted in order to make the pathway up the hill more passable. And I think this is a relevant illustration to what we're talking about today, because too often that pathway to adulthood, the transitional pathway, is marred with barriers and crevices and challenges along the way that make that pathway to adulthood more challenging than it otherwise needs to be. And that really is the backdrop to some of the research that I wanted to talk about. And I'm going to refer to several studies I've been involved with, but this one in particular, my co-investigators are listed there. And what we did was conduct qualitative, semi-structured interviews with autistic youth and young adults, and you can see the range of the groups of participants, as well as parents or supporters and service providers. And we used what we call a grounded theory approach using open axial and selective coding. And what that means generally is data is broken down from the interviews into discrete units of meaning. And those meaning units are coded and assembled through a constant comparison approach to form categories. And then those categories are examined for the relationship and conceptual content and context. And this slide just gives you a sense of the participants and the age ranges of the youth, adults, and parents. The total sample was 64 participants, which is quite a reasonable number for a qualitative study that's looking at depth rather than breadth or generalizability of the work. And I want to move relatively quickly, given our time, to what we learned from some of these results. Perhaps not surprising to folks on this call, transition, participants told us, can be frustrating and arduous with a lack of navigational guidance. Not always the case, but for many individuals, they talked about fighting or having to work hard to find services, to seek services, while at the same time being unsure about how to proceed or what to seek. Participants, largely parents, talked about needing to research, find, and if they could find services, wait for those services that were in demand, given the lack of services in various jurisdictions. They described needing to manage to complete multiple forms and laborious application processes, and noted that the adult system is substantially distinct from child and youth services, that system or sector, at least in this jurisdiction in Canada. There were multiple convoluted routes to services, so that made it more confusing. And variably, people talked about the lack of assistance with the transition to adult process and access to services. So listen to this mother who said, it's all mountains of paperwork. And if you don't have a person in your life who's willing to take the time to fill out forms, research, and do it, nobody would do it for this autistic individual. Participants talked about inhibiting or unhelpful processes and attitudes. So services were described as frequently insufficient relative to need. And those needs were a variety of things. And if we went around the large room here, we would hear of many needs. Here's a few: skill development for the individual relative to the adult world, health and mental health care, post-secondary education, employment, and crisis or complex care. And what they described was generally in some organizations or some places of service access, a lack of understanding about support needs across the diversity of autism, as well as ancillary challenges, for instance, mental health, and services without accommodating to sensory needs, and those kind of challenges they talked about in terms of the service delivery system in adulthood. And they described, in some cases, services that were often based in a deficit orientation or a medical model approach, and were not as sensitive as they needed to be to the nuance of need relative to the autistic individual. So there's an example of an individual needing crisis care due to episodic issues. And this quote from their parent, who said, the service provider said, well, just call the police and they'll take her out of the house. I said, that would be the last thing that should be done. I would never have the cops take her on a mental health warrant. I knew that the individual would kill herself if I had done that. And so that was horrible lack of support, complete lack of understanding of autism combined with mental health issues. Just take her, grab her, and put her, drag her to the clinic. We have a long way to go in thinking about services for adults. Another challenge, insufficient availability, scope, and accountability. So lack of follow-up on individualized goals. So those goals might be made in the transition process or the individualized education plans. Rigidity of service access based on various restrictions. It might be IQ level, age restrictions, level of functioning that would create barriers to service access. Other challenges were lengthy wait times, insufficient service duration relative to need, limited funding, and inaccessibility. So, and that was particularly an issue in rural communities where locations may be distant relative to one's home, and transportation issues may be challenging. Cross-sectoral support was needed. So thinking about the range of supports and where lives are lived. So financial management, social skills, behavioral supports, guardianship, housing, peer engagement, post-secondary education, employment. So when we think about transition, we need to think broadly across, do you remember that slide earlier, across the ecosystem. There are also broader issues in our jurisdiction anyway, about relating to low service provider remuneration that limits skills and retention of workers, especially in a tight job market, and funding gaps relative to access to service. So what are some recommended supports in moving forward? What individuals discussed in advancing capacity in transition were knowledge, so providing knowledge relating to transition, the process of transition, what to do to prepare for that transition process. Tangible help, which was practical assistance. Examples would be form completion or support with financial management and planning and funding for services and resources needed. Emotional support, so guidance, counseling, listening, support. Navigational assistance in terms of learning about and accessing services within one's jurisdiction. What could one access and how do those services become accessible? And training. So skill development for the individual, work skills, social skills, self-motivation, self-management. So those are some of the key supports in moving forward across the transition to adulthood. Here's an example of a helpful service provider role. We had a disability services family support worker who walked me through it a year ahead of time and who gave me the list of, this is what you have to do in this order. And it hugely helped. I just ticked off the boxes as I did them. There was a lot to get organized, but I was able to do it because I just gave myself a full year doing it. So having the support of that worker with the steps, but this also recognizes the ingenuity of parents in terms of navigating that process. And another thing that emerged was there are some positive changes that were noted. Organizations in the community, and some examples are given here, libraries, transportation systems, employers, that had developed more inclusive spaces, programs, and policies. So we're seeing some shifts. We have a long way to go, clearly, but we need to build on some of that movement forward. I want to talk a little bit more about that in terms of areas for capacity building. As we looked at our data, the steps in moving forward really could be broken down into what I've listed here as micro, meso, and macro. So micro, I've loosely defined that as individual and family support, things close to the individual in terms of their specific needs. So services that are person-centered, marked by acceptance, strong relationality, flexibility, and targeting the needs of the individual. heightened expectations and support for adult achievement. So really raising the bar of where someone wants to go in their lives and supporting them in that pathway. So that may be career or post-secondary education, indicated here as PSE. Peer mentorship emerged as important, peer support. So connecting with people along the journey who share experiences, and support for parents in the shifting role potentially of a social or life coach versus what has traditionally been a care provider, and thinking about that shift as parents age but that is premised on services available in community. So as we go to that next level and thinking about an ecological model that was presented many years ago by Bronfenbrenner, and really adapting that here, thinking about transition, not just as micro, but also meso, which is a program or personnel development, really organizational capacity building. So capacity development in residential and community support in terms of thinking about transitional support to autistic individuals and their families. And that entails training and stronger relationships across organizations and programs, so diverse stakeholder groups and sectors. Just thinking again about transition entails many sectors of our lives, and how well or unwell do those organizations or systems or sectors work together to help someone create that pathway into adulthood well. And finally, that also implicates macro level shifts. So at a policy, at a broader societal level. So increased funding to adult services with targeted programming support, and an increased perspective of autistic individuals in service planning and priority setting. Listen to this quote from a service provider who said it well. What do individuals want to see in their life to make it happier and more successful in their viewpoint? Not what we consider to be more successful, but what they are actively looking for in a meaningful life. I want to move, if I may, to an example of transition focused on accessible pathways to and through post-secondary education. And there are multiple challenges in accessing post-secondary education for some, certainly not for all autistic individuals. And in Canada, we've been working with colleagues. There's a project underway led by Dr. Heather Brown at the University of Alberta and colleagues who are developing, trying to build capacity in this area. But currently there are challenges in post-secondary education. Some examples in the literature are challenges of self-advocacy and self-regulation and in the pressure cooker of post-secondary education, college or university or trade school. The demands and resulting anxiety and the social relationships and the complexity in those settings, communication issues, academic demands and functioning, and the confounding demands of all these pieces, personal, academic, and campus life, and how that impacts an individual relative to campus life. I think we also need to think about the bottlenecks for many individuals of even accessing post-secondary. I haven't even talked about the costs, but even admission in and support through post-secondary institutions. Yet that is a pathway into career. And so we need to think deeply about that. And as we've looked at that moving forward in PSE, post-secondary education, a team here has been working on a scoping review, and I just want to acknowledge my colleagues in this work. These are some elements to advance this work and render post-secondary education more accessible. And again, as we've broken these down, they emerge as micro, meso, and macro. Let's walk through that. At that individual level, there is a need on our campuses for greater access to required services. And some examples would be accessing a diagnosis, particularly if a diagnosis is the gateway to services. Mental health services, which are important in and of themselves, let alone when we add the layer of increased pressures and expectations on a post-secondary campus. Peer mentorship, so connecting with others on the autism spectrum on campus. So those are micro level areas for development and moving the bar in terms of transition. In terms of broader programmatic advancements, campus capacity building, so focusing on the design of programs, so sensory-friendly spaces, including classrooms. There may be universal design, things that will improve the campus for everyone, but would be particularly helpful for autistic students or others on campus. That may be faculty members. One area of design is intentional stigma reduction programming and resources on campus, and training across the campus to move towards more inclusive spaces on our post-secondary campuses. And lastly, some broader issues, macro issues that we need to attend to if we really want to render ourselves accountable for some of these shifts. So an orientation to strengths and student experience. So really paying attention to that in terms of the programming and the support for programming and a bedrock of supportive policies, and really building on some of the work that is being done in terms of, I've said here, EDIA, equity, diversity, inclusion, and accessibility on our campuses. And some shifts that are needed, like services not being dependent on the disclosure of a diagnosis, and sufficient funding so that post-secondary education is truly accessible to all autistic students. I think the point in this kind of illustrative example of post-secondaries is to think holistically. So the individual within the community, within the campus community. And here's several elements of that community that all can be shifted to be more amenable, accessible, to make the campus more inclusive and welcoming. So when we think about course design, the assignments that may be made less challenging or more resonant with varieties of styles of learning, campus resources that are accessible, career employment supports as people move beyond campus life into career. Research, what are the priorities of autistic individuals relative to research that's being done on our university campuses? Residence life, the sensory environment within residences, and instructors and fellow students as colleagues in this journey that are engaged and supportive in creating inclusive, welcoming spaces. And that happens within policy. So there's the broader ecosystem. And lastly, in the discourse, the values, the premises upon which some of these decisions and processes and programmatic offerings are given. And so we need to think about this broadly at each of those levels. How do we move the needle in each of these areas? And where we've come to, some of the priorities are notions of mentorship or relationality on campus. So connection, social connection, and peer support and engagement with others in constructive ways that are supportive. Engaged networks, so involving individuals across the campus, across sectors of campus life, to make our campuses inclusive spaces. And lastly, opportunities and choice. Services can't be one size fits all, but rather reflect the diversity and needs and interests and preferences of various individuals across the spectrum. And finally, we need to think about the ecosystem along the temporal line of time passage. So the transition to adulthood is just one of many transitions, but it's transition from secondary, from high school to and through post-secondary education, and then on through transition to career, and then on in terms of later life. And so thinking that through in a broader sense may help us. And I want to move to another example in the realm of transition, and that is employment. Here's the words of a mother of an autistic adult. What my son needs now is job skills. He needs to survive in this world as a young adult, with or without his parents' help, because not every young adult with autism has parents or has the supports, right? Whether it be parents or other family members, not everyone has that. So he needs job skills. He needs life skills and life training. An autistic individual working said, the problem is I can do the job well, but I can get anxious on the job because I'm comparing myself to other people and I'm analyzing. I don't do the job like other people. I see the power dynamics and the way it treats people, and it gets to me, because I'm passionate about the job, and I don't like it when other people are not passionate about their job. It's horrible. I hate it. So numerous challenges emerged in our research in an earlier study that we focused on employment. And these are some of the challenges that were identified. So emotional, psychological challenges, anxiety, strain, lack of confidence, self-esteem, sometimes contributed to by that negative work experience. Sometimes it was very positive, but sometimes it was negative. And we need to think about, how do we smooth that path? Focus and concentration relative to the demands on the job. So an individual said, I can't think of doing 4 things at once. I can focus on one, but what if the job doesn't permit that? Varying challenges. Another talked about studying for hours and seeing patterns, but can't remember. Yet a lot of the information in the workplace was conveyed verbally and without the supports and accommodations to make it work. So we need to think about the right fit of work, but also the resources on the job that would make that palatable for an individual. Environmental processing, so sensory issues, verbal details, and time insufficient to process tasks or emotional situations. And often the challenges would come up, but then there was a compelling movement to another issue and not time to discombobulate. Social relational issues, so challenges in terms of non-supportive colleagues or supervisors. Others were not direct in communication. Some autistic individuals described, get this, being critiqued for being too honest, that virtue. Direct communication was viewed as blunt. Difficulty with strangers in terms of communication, and some of the entry-level positions often are in areas like hospitality or retail, which are often dealing with the public, with strangers, and that presented challenges for some, certainly not for all. So these are some of the challenges that made that pathway more challenging than it otherwise needed to be, and if there were the supports and processes in place. So how do we think about that? And let's return to this notion of ecosystem in employment as we think about moving forward. So accessing a job, engaging in the job, retention of the job, a critically important issue. And if I was to add one more, I would say advancing in the job if that individual wanted to do so. So one of the components certainly is individual support, job preparation, job skills, life skills, job access, so fit of the components of the job for the individual, job retention and advancement support, but not just focused on the individual, also community workplace capacity building. So organization and employer capacity and understanding, knowledge, workplace adjustments such as sensory and environmental shifts to make that workplace more inclusive, challenges managing hurdles in the workplace and how to move forward in a constructive way, navigation and support. So honoring the family role that often, in many cases in our research, had a role in terms of supporting finding of work, but also augmenting or easing the family role. But that's presumed on services within the workplace or community that are also supportive and assisting as needed for the individual to thrive. And so community resources, services available and accessible, information navigation, being able to find those services, and that being built on a policy framework, and thinking deeply about the rights of individuals within the work setting and elsewhere in our community. So there's some emerging principles in these examples that I just want to touch on. Certainly intentional access. So really thinking about how do we move the needle to make adult-based resources, opportunities, options truly accessible, which really invites multi-sector integrated engagement in thinking about that broader ecosystem and who needs to be involved in moving towards solutions. Think about flexibility of options and resources that fit for the individual, that are desired, that are there, fit with their preferences and their propensities and areas of interest relative to options. Moving from a one-size-fits-all narrow approach to services. And finally, navigational support to access what one wants and needs. So our research recently has looked at integrating navigational services, a service system within our jurisdiction, and it's built on the bedrock, the premise of equity, diversity, inclusion, and accessibility. That's the underlying foundation, and built on that is a training component across the jurisdictions, across services partners in this navigation service network. Coordination of services, so trying to work well between the system, that's that meso level, building connections within services, so linked networks, an intentional focus on stigma reduction in community, a lifespan approach so that services are available as needed, when needed, along the lifespan. And then that is built on evaluation framework that is important to continually build capacity. And what we're looking at is integrated care that is focused on universal to complex care, accommodating the individual and family needs, but also attending to barriers relative to social determinants of health. So thinking about how do we support individuals and families where they're at. And what individuals in our research have spoken to us about is these three components of a navigational support service that would assist in that transitional process. If we look at this as sort of three steps, the bottom stairs or step, number one, resource information, is online, regional, and in our case, province-wide information that is available 24/7 that offers navigational support for services and resources. So accessing those services, so information people can get. Secondly, on stair number two, a jurisdiction-wide peer support network. So a system to train and connect individuals with lived experience. And that could be autistic individuals as well as parents or family members. So liaison and engagement with community resources. So to support with that journey, but to connect in terms of the challenges and options in moving forward. And finally, as needed, individualized service, which is probably more traditional navigational services, paraprofessional telephone navigators, and these are located in various regions within our province that offer support and advocacy as needed relative to service access. So we've talked about this notion of thinking holistically across the ecosystem. We've talked about service navigation, post-secondary education, and employment. So thinking about that community, that integration of supports and services, nestled within policy. And I want to finish and talk a little bit about discourse, thinking about the discursive framework, the values, the presumptions that are made that upon which some of the decision making around the service is given. And thinking about that again from the process of early life, transition from high school into adulthood, which is the focus today, but then on into mid and later life, thinking about those elements holistically in terms of what resources can support someone along that lifespan journey. I want to illustrate this discursive context relative to the transition to adulthood with a billboard that was in my community several years ago. And as you see there, it says, "See the ability." So it's really pushing against stigmatizing presumptions and really thinking broadly. So it says, "Meet Nicholas. He has a girlfriend, a great career, and loves his life. He also has Down syndrome." And this was produced by the Canadian Down Syndrome Society. And I appreciate this billboard in that it really is about pushing against presumptive notions related to disability and ability and diversity in our community. And it introduces us through Nicholas to possibilities related to relationships beyond the family of origin, to career progression, and what I really appreciate is the quality of life. Loves his life. So I appreciate on many levels, but it also makes me wonder about some of the presumptions that we make relative to pathways to adulthood, markers of transition. What constitutes adulthood? What are the pinnacles of adulthood? And it seems like some of those markers, those fixed markers, are about independence. And I wonder if we could take a moment and just critically reflect on that relative to the spectrum of autism, the diversity. So independence as a marker, external relationality, moving away from the family of origin, so which assumes relational engagement and social skills, a future orientation in terms of moving forward in career, which really speaks to agency. And I appreciate some of the recent work on self-determination. It's so important across the spectrum that people have the opportunity to thrive and move in areas that are of value to them. So I appreciate that notions of agency in health and post-secondary education and vocation. But I also wonder what that means, some of these fixed markers in terms of moving to a good adulthood relative to diversity in theory of mind or challenges in executive functioning. And I wonder if it really reflects a notion of sort of a singular path to adulthood that is prescribed and is really amplifying notions of independence. And in some ways, aren't we all interdependent? And so I wonder if the pathway to adulthood is rather than a singular pathway, but is much more circuitous and interlinked and laced with diversity. And if we could welcome that for the individual, and I wonder if the pinnacle to that end is not so much independence per se, maybe that's, but also importantly, quality of life. And I wonder if we've talked about, I talked about that enough. In the beginning of this talk, one of the critiques of the literature was that quality of life was not upheld as a marker to which we are moving in our pursuit of transition and moving into adulthood. So I wonder if that is a challenge for us as we think about the presumptions. And I've appreciated this notion of quality of life from Raphael and colleagues who talk about being, belonging, and becoming. Being is being who one wants to be, and belonging, a welcoming environment, citizenship, and all that truly means. And becoming, the pursuit of aims, the degree to which a person enjoys the possibilities of her, his, their life. I slightly paraphrased Raphael Attal's writing here. I wonder if we need to think about that process, some of the presumptions as we are moving into adulthood. And but I wanted, as I close, summarize with some of the key points. The first one is accessible post-secondary education is important, and we have a long way to go to make it more accessible, and both in terms of moving into post-secondary education, but also through that process. Secondly, getting a job may require a range of supports, and we've come some way in terms of thinking about some of those resources, but we've got a long way to go in terms of thinking about pathways to work sustainability and for the range of folks on the autism spectrum. Thirdly, accessible pathways to post-secondary education and employment are integral. And quality of life can be enriched by meaningful post-secondary education and employment. And navigation support nurtures transitional pathways in the life course. But all of this, seems to me, needs to be in the interest of supporting and pursuing a good life on one's own terms and belonging in community. Such critical notions as we think about transition in adulthood, and really celebrating the life course and supporting folks on that journey as we move through life together. I need to close and want to open it up for comments or questions, but just some implications as I tie things up here. We really need increased resources to support paths to thriving, and certainly in our jurisdiction, but across jurisdictions around the world, heightened consideration of the ecosystem, of those broad elements that have a bearing on supporting individuals to thrive. And to that end, collective impact and action. So really moving our learning quickly, mobilizing that from evidence to action in a more seamless and timely way, which really invites participatory engagement of relevant systems and stakeholders to that work. There's a need to proactively address intersectionality and inclusion of areas and populations that face barriers relative to the social determinants of health. So that may be issues of poverty or immigrant status or various intersecting challenges that come alongside some of the barriers that autistic individuals face more generally. And as we've spoken about, a greater focus on quality of life as the pinnacle in this journey towards adulthood and walking through the course of life. For the researchers in the virtual room here, just some thoughts relative to moving forward. I think this work really invites deep research partnerships in community, which invite participatory and community models, data sharing. So really using our data, capitalizing on the good work, the data that's out there for quickly and broadly building capacity and utilization in community. We need more intervention and model-based research in terms of strategies and approaches to support transition, and research that is longitudinal and really addresses the life course. And may I add, really thinks about the transitions plural across the lifespan and how to ensure support along hurdles that may emerge along some of those transitional points. We need to engage research with broader inclusion in samples, so age, sex and gender, autism presentation, and broad ecosystem factors or sectors that I've spoken about here, and more that really think about the range of elements that have a bearing on transition. as I've spoken about key engagement of lived experience, both in terms of the design, but also the prioritization of areas to develop in research, and examining the socio-ecological and policy determinants of transition and those outcomes, and developing metrics and methods of assessment at these broad areas, so individual, programmatic, community, and even societal levels. So we've got some work to do. I want to just acknowledge on this busy slide the literature that I've used in this presentation, but really the breadth of important work that's been done in this field. And as we move forward, the thinkers that have tried to move this forward based on the generosity of individuals who have shared their experience in research. I want to close with a statement by an advocacy leader and scholar in my part of the world, in Canada, the former Chief Commissioner of the Ontario Human Rights Commission, Dr. Catherine Frazee, who so aptly said it in my mind. She said, citizenship means having rights, but it also means belonging in schools and universities, in places of work and places of worship, in politics, art, and commerce, belonging in families, community, and a nation. Thank you. I'll open it up if there's any comments.
So there are a lot of questions. People who are still here, if you want to type questions into the Q&A section, there's some questions in the chat as well, and we'll try to get to those. The Q&A section is open now. So this first comment or question is from Carolyn. She says, I find a lack of understanding for autistic individuals who have a very hard time knowing or deciding what they want in life, even given experiences and choices. I find that family input is often largely discouraged when they're the only ones who truly have any idea of what that person may want. Have you had others voice this concern, and how have they addressed it? Are there resources for addressing that specifically?
Yeah, it's a great comment. And yeah, we have heard notions like that, and thank you for that. I think there are some resources. So one example that comes to my mind is a US-based intervention using the acronym COMPASS. And so if you Google that is a resource that supports individuals at the point of transition in terms of kind of thinking about options and pathways forward, because those are very difficult questions. I also, one of the things that we've grappled with is that the runway into adulthood is often truncated. So options for internships or vocational options in high school sometimes are less accessible to autistic students in high school. And I think that we need to do the opposite. We need to make pathways more lengthy, and so through high school, have those conversations with students that really open up options and allow exploring and involve trialing. Often first and second jobs don't fit well for individuals, but if an autistic student doesn't have access to those experiences or internships or work school experiences, they may lack those options. So I think finding those pathways and integrating them within those earlier years of high school, thinking long-term about some of those options and using some of those resources like COMPASS may be helpful.
Okay, and this is in some ways a comment because I think you addressed the question here, but Sandra is saying, I found that various service providing agencies and programs tend to be siloed, such that each one does just one thing and has some vague sense of what each of the others does. But there is little to no collaboration or communication between them, so that students who may benefit from those services and supports from several of them are expected to identify and self-advocate for each thing that they need from each program or agency, as well as to coordinate and manage them all themselves. So yeah, validating much of what your presentation was about and also what you just said about COMPASS. Okay.
Yes, important comments.
Yeah. Lots of comments from parents. I'm a mom of an autistic daughter who's a junior in high school. I'm so thankful for this information, and it's also very emotional. If a student could do all of the communicating, organizing, and coordinating, they probably wouldn't have an autism diagnosis. That's a comment from a parent. What are your thoughts on supporting those with a more profound form of autism who struggle with aggression and self-injury who are transitioning to adulthood?
Yeah, a great question. And I think, some we found in our research was there really needs to be some careful training and resource capacity building in the community and residential settings, and thinking about autism-based learning in some of the more broad disability-based organizations or mainstream resources in community. And so I think that when I think about some of the capacity buildings, that some of the intentional training, and one thing that we've tried to do is create online training that is accessible to navigators so that we bring that base of training. But I think that some of those intense levels of support that are needed and really thinking about some of those resources are a real challenge that we need to address, particularly given the disproportionately less resource base that's available to adults on the autism spectrum. So I think it's an area of capacity building for sure.
This is mostly a comment, just talking about her son attends a day program and the staff turns over constantly because of low pay. Have you seen any agencies addressing this or trying to address this so that there's better compensation to keep people in those jobs?
Mm-hmm. Well, I agree with your comment. It's a big issue that came up in our work, and there is. I think one of the areas that I've seen is really thinking about accessible pathways to career in these fields. So ways to provide training we're talking about post-secondary access for autistic students here, but also for training and supporting individuals to see support services as their career rather than a step in their career towards other positions. And that really does call for issues of remuneration increase and some professionalization, as long as that the focus remains on supporting the needs of the individual. And so really thinking about how do we do that well and partner with other disciplines in moving that forward and creating that bedrock of support. That's not a great answer. I think that this is an ongoing issue that we need to deal with in our professional schools, but also be advocating with our governments and other frameworks who are decision makers relative to remuneration of support workers. That is critically important work, and it needs to be valued as such.
Right. This is an interesting comment. We live in a highly and quickly developing world. It is normal and expected that a normative person will change jobs many times in his life, often undergoing constant training. How could it be expected that an autistic individual could keep up in this rapidly evolving environment? It seems the models for job training, when and if they exist, are for a disappearing world. Can you comment on this?
Mm-hmm. Yeah, I would say, in some ways, similarly for autistic individuals, there might be elements of exposure to job options that may or may not fit for that individual. And so my concern is often autistic students have less access to try options along the way. And to your point, see what works and what doesn't. And I think that we need to really think carefully about starting that process as early as possible to create access. And I don't know as those jobs need to disappear if there's a good fit. but rather could the model be that that individual would stay in that role? So I think your point's well taken. The kind of the job access process has shifted, although if really it's all in the interest of finding fit for individuals, they move on until they find a fit often, and that may change, but it may not. So I think rather the kind of the challenge and opportunity moving forward is resources within our jurisdictions that help individuals find fit well, and then provide options within the realm of those possibilities, so people can start to identify places and resources and employers that are part of that broader ecosystem that can make it work. I appreciate your comment, and it's a we're in shifting times for sure, and I wonder too, post-COVID, if there's been shifts around certainly a tight labor market in some parts of the world, but also shifts in terms of how we view our relationship with employment and kind of life choices.
I know we're running out of time, but there are a couple more really good questions here I want to make sure I run by you. This is a parent that says, we participate in many social groups. They're filled with aging parents navigating for their adults with autism. All the adults have skills and strengths, but we all ask what happens in living situations as we age. I think we need to look at housing assisted living for parents and adults with autism. Do you know of any programs like this? So parents and their loved ones living together in an assisted living situation.
Yeah, there are different models of housing. It's a great question and such an important issue. I do know of different models, and maybe just in the interest of time, I'd refer you, I've appreciated the work of Aid Canada. So aidcanada.ca. It's an online informational resource in my country of Canada. And if you go there and you Google housing, there's housing toolkits and a toolkit and an infographic that actually have different models of housing, and that might be a good place to start to think about some of those models. This is such an integrally important question that's being raised, so thank you for this.
Okay, this one I think you may have some insight about. I have a client in a PhD program. They want to argue against being required to take the oral part of the comprehensive exam, but instead to do something else to assess their abilities, like writing a paper and delivering it. Where might we get some support for this accommodation request?
Well, I'd invite you to be in touch. We've looked at different models and explored some of those relative to examinations and pathways in post-secondary education. So some of this, we're looking at various areas, but that's one area. So I'd welcome a conversation with this individual after our conversation. My contact is on the screen here.
All right, great. Well, I know that we're out of time. There's still lots of questions. So David, maybe we can have you back and do another presentation and do some Q&A sometime soon.
Happy to, and thank you for these great questions and for your engagement in this important work as we move